We're really excited for our call today. We have a special guest. We have Susannah Savage from Senator Warren's office. She is a health policy advisor for Senator Warren. So I'm going to share my screen and start our PowerPoint.
I'll keep it mini.
So I know you guys know about the ARC, so I'm not going to do the ARC spiel. So I'll just go quickly over our agenda today. So as I mentioned, we're so excited to have Susannah Savage with us. We're going to hear from Susannah about the American Rescue Plan Act that was recently passed and other bills that are up for proposal and other federal initiatives. We just heard from President Biden about his infrastructure plan, so we'll hear about that from Susannah. We'll do a Q&A after her presentation, and then I'll talk quickly about the disability policy seminar, and then Maura is going to go into some important state policy updates. So Susannah, I'll hand it off to you. Again, Susannah is the health policy advisor for Senator Warren, and go ahead, Susannah. And
yeah. And making sure you guys can hear me okay?
Yep, you're good.
And yeah, I was trying to figure out how to change my name. I haven't figured that out, but I'll just go ahead and you guys can tell that I'm Susannah.
Yeah.
So yeah, I am Senator Warren's health policy advisor. I've worked with her for about 5 years on a number of her teams, ranging from her oversight and economic policy and labor teams, and I'm now leading her health team. And so, yeah, just wanted to touch base with you guys since there's, of course, been a lot of movement in Congress recently in terms of funding. I mean, as you guys are aware, the American Rescue Plan Act included a really large investment in home and community-based services. We were extremely excited to vote for the package and that component. We've been hearing from folks and understand that there has been a bit of confusion and just lack of clarity over exactly what funds from the American Rescue Plan can be used for. We know that in the text, there was sort of very explicit requirements that this needs to supplement, not supplant, existing programs, and sort of included some guardrails and guidelines for what states could do. But we are sort of trying to, CMS is working to try to develop sort of more clear guidance, and we are in touch with them in general, and I think are happy to be a resource moving forward as sort of questions continue to come up and sort of be that federal sort of touch point with the agency to try to get questions answered quickly as they come up. Moving forward, I mean, I think we were also excited to see that Senator Biden's infrastructure proposal from last night includes sort of a $400 billion investment in home and community-based services and the home care workforce. The details of that plan are still fairly, they are not totally sort of sussed out yet. I think in general, we get the sense that the main goal of the proposal is to try to eliminate sort of existing wait lists in HCBS, so provide enough funding to eliminate those, as well as to try to really ensure that the workforce can be paid a living wage and receives adequate training and is sort of able to function well in that environment. We're actively sort of working with Senator Casey, Senator Hassan, Senator Brown, and other folks in the Senate and House to try to make sure that our goal is to make sure that the legislative text that this proposal turns into is as robust as possible within the framework of Senate reconciliation rules and sort of budget requirements. And so I think just discussing that now, I think over the next few months, hearing from you guys about draft text as it emerges, about what should be included, is going to be really, really important so that we can make sure that it's sort of exactly where it needs to be. I also wanted to touch base quickly on the Htbs Access Act. So the senator, as some of you, I probably should have mentioned this at the beginning, the senator for the past few Congresses has been on the Senate Health Committee, which is primarily focused on public health sort of infrastructure like NIH, CDC, along with things like education and labor. And this Congress, we moved to the Senate Finance Committee, which among other things has a lot more direct control over Medicare, Medicaid, private insurance. And so we are really looking forward to sort of being on the committee and using her new position there to really get into the weeds and into the details of how to improve things like Hcbs and other programs. I think we're actively taking a look now on the Hcbs Access Act. Senator Casey's team flagged it for us last week. I think very broadly, the senator is really excited about the idea of making Hcbs sort of a mandatory benefit under Medicaid. And I think diving into sort of very broadly what the senator is thinking about long-term care and her role on the finance committee. I mean, Hcbs and Medicaid are incredibly important services, but there are a lot of people who are relying on Medicaid or buying into Medicaid separately or using special sort of mechanisms because private insurance, Medicare, I mean, other forms of coverage do not provide the long-term and home and community-based services that are necessary. And so I think the senator is really hoping to hear from folks and is starting to dive in a bit more on thinking about what a broader sort of long-term care expansion, both within the Medicaid program, but also outside of it, could look like. Sort of thinking that the senator believes that this type of care is really important and is a human right. And so it's something she wants to focus on expanding. And then I think the last thing I'll touch on, and I'm of course happy to answer questions. I know I've been sort of speeding through this a little bit. She is starting now, that we have an administration that is trying to expand and support rather than dismantle like existing Affordable Care Act rules and sort of health law. She is really looking forward to pushing the Biden administration to ensure that the Affordable Care Act and sort of insurance requirements that plans are putting out align with the ADA and are sort of providing the services that people need and that people with disabilities are not being denied critical care because insurance companies are sort of not, are sort of weaseling around sort of ADA and ACA requirements. And so she's working with Representative Porter on the House side on how to push the DOJ and HHS to really focus on this early on to try to improve some of the limitations that folks have been sort of experiencing. I'll stop there. That is sort of an overview of stuff that we're focused on. In addition to all these packages, the appropriation season is coming up. So we're always keeping an eye out for areas we can be supportive of expanding funding for additional programs. The senator really sees this 2-year period, hopefully longer, but this 2-year period of having President Biden in the White House in a Democratic slim, but still Democratic majority in both houses of Congress is a really big opportunity. And we want to make sure that we utilize it to the best of our ability to make sure we can get as much done as we can. So I'll stop there and of course, happy to answer questions.
Okay, well, if anyone has questions, you're welcome to either unmute yourself or you can chat in the chat box.
You want to stop the share, Ellen, because then I can see people better.
Oh, sure, yeah. Hold on. Stop my share. There you go. Well, I have a question, Susannah, if just give people an opportunity to think about what they want to ask. So you mentioned that the infrastructure proposal that Biden is putting forward related to the Hcbs Access Act. Like how much of that bill, and I know that's still a discussion draft they're trying to get feedback for, but we've had versions of that bill before. How much of that bill is in the infrastructure proposal? Which I know is still murky in details. And then getting it passed, how much of that is like all of that has to be through the budget, right? I mean, because there's no way it can get passed otherwise. So I'm just curious, like what is in the Hcbs Access Act that is in the infrastructure proposal?
Yeah, so I mean, so right now, the president's sort of infrastructure proposal is like a very, I mean, it is detailed, but in terms of like actual legislative text, it's a very, very high level outline. And so I think the my understanding, and I think my colleagues' understanding as well, is that I think the president would be supportive of including a lot of the Hcbs Access Act text in sort of the final package. It's also, and I think that there are, so you folks might already be aware of this, so apologies if I'm saying something folks already know, but unfortunately, we're not anticipating that we will get up to sort of 10 Republicans to wholeheartedly support this infrastructure proposal. And so the plan is to sort of pass it through budget reconciliation, which only requires 50 votes, but also requires text to be very, very connected to spending. So I think that, and you know, I'm chatting with Senator Casey's team tomorrow about this. I think the goal will probably be to find a way to draft the Hcbs Access Act and other sort of Hcbs proposals in general as closely as possible to the budget and to sort of funding mechanisms so that it can be deemed a budget provision as opposed to a policy change. And I think that opponents of making HCBS mandatory could argue that making it mandatory in the program is a policy change, whereas if the provision is drafted carefully such that it is a budget, it is sort of seen as just increasing funding for the program, I think that is a way that it could get through. So a lot of these things are happening in tandem, if that makes sense.
Yeah, I know Alexis had a question.
Yeah, hi, so Alexis Levin, I'm an elder law and special needs planning attorney. And so question on the American Rescue Act. So we know there's extra money coming on a temporary basis for HCBS, and we're all really excited for that. And when we try to find out, well, what does that actually mean? Like nobody knows. So what you just said is that CMS is working on the details. Do you have any sense of a timeline from them and when we might actually see HCBS increases, you know, the temporary ones here in Massachusetts?
I unfortunately don't have a very clear sense of timing, and I can follow. We're also sort of trying to figure that out from them, and I can follow up with them and reach out to them again to try to get better clarity on that. I think that in general, our sense of working with HHS has been an understanding that all of this needs to happen like yesterday, like it should be happening as fast as possible. And I think that, you know, they are working quickly, but they need to be working faster. So I can push them on that.
So, and then a second question is, in the advocacy community, whenever we talk about HCBS versus, you know, that it's so easy to get nursing home coverage, but impossible to get what you need at home, the answer we always get is this anecdotal, well, it costs so much more to stay at home. But then when we go like asking, does anybody have actual data? Like nobody has actual data. So do you have any idea if this 1-year experiment we're running with American Rescue has any data collection requirements in it?
So I think that in general, the sort of claims data that will be generated at CMS will enable sort of a lot of research. I mean, I think that another thing that sort of folks are very aware of in both the HCBS expansion and also other provisions of the ARP is that once sort of additional benefits are provided or additional things are provided to folks, and in this case, I think it's the 2-year or not 2-year, this period of time, it's hard to take them away. And so I think that while we are hopeful that even with or without that sort of specific data collection, I've seen a lot of different sort of proposals or sort of research on different cost analyses that this is something that's going to sort of stay put. I would also say that I think that at least and you guys would know this better than me, but at least on the federal level, I think the coronavirus pandemic has really shifted and changed the way people talk about nursing home and institutional versus home-based care. I think that, to be honest, like the cost sort of conversation has sort of really diminished as people have seen what has happened last year when people were forced into institutional care that they didn't necessarily want and then were forced to deal with the coronavirus pandemic. So I do think there has been a bit of a shift in how people are talking and thinking about it. It's seen a lot more as like cost or no cost, like it is seen as a necessity now that I don't think that it was being discussed at before, if that makes sense.
Yeah, no, that's great. Thank you.
Alexis, I would just jump in quick to say, well, one, I know there was a meeting yesterday and Ellen might have more information about that, but I know that we are looking to put out an RFI, a request for information, and that our HHS is saying they will know more in May. I don't know, Ellen, was there more that you
Yeah, and I
learned
think,
yesterday?
right, Secretary Sutters was trying to reassure people that even though the time frame is literally starting today, they're still waiting on the guidance, but they're not going to leave any money on the table, and they're going to make sure that you know, if it needs to be like retroactive or whatever, but they're going to work, even though it's a 1 year frame, they're going to make sure that there's no money that would be, you know, left because of the delay in getting the guidance.
Right, and sorry, I would just add one.
They did say that there's a request for information that they're going to be putting up, if they haven't already, on proposals around this funding for any stakeholders or advocates
Oh, okay.
for their input.
An RFI coming.
Yeah.
But I would also add one quick thing, because the ARC and Advocates for Autism of Massachusetts put in comments this year for quality measures around HCBS that CMS was looking for. And both organizations wrote in that we needed better data collection on HCBS services in general. And so hopefully that's something they will add.
Awesome. Thank you.
Just to clarify that even though it wasn't confirmed officially, they did believe that it was a very broad sense of HCBS. So programs like AFC and other self-directed care programs that we may not consider under other waivers in Massachusetts would be included in this HCBS funding.
Mm-hmm. All right, I see Joss's hand up.
Yeah, we also have a chat question. I mean, I think whoever, it doesn't matter, but I did notice that there was a chat from Beth. I can read it. Many adults who have autism but not intellectual disabilities struggle to find and maintain housing and to identify and retain the home-based supports they need to survive. In this state, only minimal supports are available through DDS for this autism-only population. Might some of these new HCBS funds start to address these problems for this substantial population?
A great question.
Yeah, I mean, and I think that this gets back a bit to the need for some clarity from the federal government on what exactly can be provided. I think my sense of congressional intent in developing the proposal was that it should be as broad as possible and should be able to be used to support funding like this. But I think getting that clarity from CMS will be helpful and can certainly follow up, as I said, follow up generally with them. But I'm happy to bring that up as well, sort of to see if I can get specific clarity on that.
Great. Jossie?
Yes, my question is, I had a question about the Hcbs Access Act, because you were talking about crafting the language so you could put it into the reconciliation for the infrastructure bill. But what I was curious, would the Hcbs still be a standalone bill, or would that be off the table?
No, yes, I think that sort of all of this will be happening in tandem, where I think that the goal is to have it be a standalone bill, and then to the extent possible, get provisions of it included as is in a broader package. And then if the way that the bill is drafted cannot work perfectly with the reconciliation process, sort of work to develop sort of the sort of infrastructure package specific text to get it through reconciliation. And then at the end of that process, which is sort of hard to predict in advance because of how the sort of Senate it's the Senate parliamentarian makes decisions about what can or can't be included in a bill. Once that process is over, it will be we'll be able to take stock of like what was included, what wasn't, and what might need to pass through regular order if possible.
So then
Sorry, go ahead.
So wouldn't the Hcbs Act at that point be altered then? What would it be? It would be looking at.
So it would not, the text itself would then have to be, yes, based on what, if anything of it passes through reconciliation, in order to get additional provisions of it passed that we would want, it would need to be sort of redrafted as a proposal in order to get it through. I think that getting to that point would be a good thing because it would mean that certain pieces of it did pass. But I think that at the moment, the track, like sort of these things are just operating on dual tracks where Senator Casey and Hassan and other teams are operating to try to just get the bill out as is. And then there's also conversations happening about how to include pieces of it or versions of it in the package. Again, it's fairly broad at the moment. Yeah.
Because I know, like, for instance, there's a draft text out there for people to make comments on. That's not related to reconciliation. People should make comments on that.
Yeah. Yes, absolutely.
That.
People should be making comments on that. The sort of reconciliation conversations are like separate, and also they're sort of vaguely happening at the sort of level that I'm discussing now in terms of trying to decide what is or isn't going to be included, but the actual like conversations about what will be in the reconciliation text will probably not occur for a few months. So yes, the focus should be on getting that text exactly where it needs to be before it's introduced.
All right, thanks.
I see one more question in the chat. Allie, did you want to unmute or shall I read it? I can read it. Allie's asking if, how do we get transparency around what the districts, receive? And I think that's a good question. When they leave it up to the districts, there's nothing short of an invisible slush fund that's invisible to parents and no answers from the district, and they hide behind the HIPAA and the individual case comments.
Yeah, and that is something that because some of this hasn't been fully implemented yet, I don't have a direct answer right now, but I can add it to my list of things that I can chat with CMS about in terms of, and I know that there will be some state federal sort of interaction here, and I'll sort of be able to figure out the federal piece, though I think the state, I can sort of, there are other folks I think in state who might be able to answer that question.
Yeah, we'll have to get Mac on that one.
Sorry, it's Allie. I'm driving.
No, thank you for the question.
Yes, I was the one with a question. I'm sorry. I'm from Beverly, and this is just a constant thing, and I'm sure many parents are experiencing it. The second you got anyone, I don't want to say you guys, but the second there's an asterisk on any regulation, state, federal, etc., where it says, we're going to allow it up to the district, we parents are getting screwed. We really are. The districts just hide behind this, and for example, kids are going back to school here in Beverly, I'm sorry, I'm just a frustrated parent, but they use those labels, and tired of that too, because then it's our problem that we're frustrated, not them, that, they're creating this situation where, again, the high school is not going back to school. They're going to do hybrid. Because again, an asterisk, even though Baker said, let's get everyone in school, the district gets to send whoever they want to go back to school. So I just want to I'm a hammer out here in Beverly. If anyone is up in the North Shore, I probably have a red folder in this town. So yeah, I'm just going to keep driving that point home. And, hello to anyone out there for Autism Acceptance Day.
Yeah, thanks, Allie.
Yep, I keep pushing that. And we have a new diversity and inclusion committee up here. And I don't think they thought a little person like me would go up there and start knocking for people with autism. So I did. So FYI, look in your town, guys, see if there's diversity and inclusion, and go out there, start knocking. Because our kids need to be included too. So sorry for my rant, but yes.
No, that's great. Thank you, Allie.
Yeah, thank you. And I can also make sure, Allie, that I can also just flag in general for our education policy team as well, some of the concerns you raised too, just so that they're in the loop.
They're huge. We keep getting hit with it. And I know it's got to be statewide, because every town's got to be taking advantage of this, because it's linked to their funding, and I was on a call the other night, and I'm sorry, it was just pure smugness on their face. They're like, well, you know, it's up to the district, and they just shrug their shoulders at us. So that's my 2 cents for now, and I'll go on mute. Thank you.
Hi, my name's Rosalind McAley. I'm just like you in the city of Marlboro. They probably had a party when my kids graduated, but you're right. They do that. They take that as they can do what they want with it. They do not seek input. So that, I think, if they are forced to have input from families, or at least have a hearing or a, I don't know, listening tour, that will make a difference. So I think things like that are very helpful and can put them on the spot. So we can say that this was our input, you did not take it.
Mm-hmm.
So
Agreed. And 504 and the IDEA Act are written that they are essentially, and there is case law on this. See, I am a pain in the butt. There is case law on this that districts are to be disabled proactive, assume funding, and plan for our children to be included. That it should not be parent reactive. It should be disabled proactive, not parent reactive. And I'm going to take out a billboard on this soon. I swear to God, I am. So sorry, that was another 2 cents. Thank you.
Okie doke. I just want to make sure we get to Randy's question around money follows the person and ABI waivers in the Rescue Act funding.
Yeah, and on money follows the person, that was actually, and I've been discussing how the infrastructure package has been very vague. Actually, it was specifically included renewal of money follows the person in sort of this upcoming package. So we were excited about that. And on ABI waivers, I'm going to have to get back to you, but I mean, the senator is sort of renewing MFP, and it's something that we're going to be looking forward to in this upcoming package.
There's a 3-year reauthorization in the last COVID package that was passed.
Oh, great.
At least, yeah, that, but then I think you're right. The infrastructure proposal
would renew it further. Yeah.
Right.
Apologies.
There's one other thing in Biden's announced plan that I know people have questions about, and it's, allowing caregivers to be paid. And I know it says he supports it, but it doesn't have, obviously that much detail around it. But we had met with your office and Marky's office back at the beginning of COVID, because God, there wasn't a more important time for this policy to have been lifted, when parents were doing all the care and couldn't get the reimbursement. So do you know anything inside around what that actually means?
I unfortunately don't know any sort of additional details, but it's something that we're sort of actively following, and I think would look forward to as this continues to maybe set up another meeting, and also just return to some of the conversations to make sure that it's sort of the most robust policy possible.
Great. Awesome. I don't see any other comments. Do you see anything, Ellen?
I don't. I did include in the chat just where people can, if they want to submit comments related to the Hcbs Access Act.
And I also put in, Donna had asked for contact information, and my email is in the chat as well, and folks should feel free to reach out at any point. And if I can't answer the question, I can try to find the answer or connect you with the right policy person on our team to be able to answer questions as they come up.
Thank you so much, Susannah.
Thank you, Susannah.
You can see that everybody was very excited about what's happening on the federal level, and obviously Senator Warren's been such a champion for us, so we really appreciate you joining. I see there's a question from Paul. I mean, Paul, do you want to just unmute? If it's a quick question, we can go ahead and try. I know we're going over in time.
That's not a question, that's applause.
Oh, it's an applause.
Oh, sorry. All right, well, that's good too. Thank you.
And I would also just say, I mean, so much of the work that the senator is able to do is because people like you are telling us what's going on in state and are constantly reminding us of what we should be focusing on. And so please, I mean, you have my contact information, please keep it up, and make sure, please hold us accountable to be doing what we need to be doing. So thank you for that.
Thank you. Thank you. All right, I'm going to go back to sharing my screen. Whoops. Now I've lost my PowerPoint. Sorry. And here we go. So I just wanted to remind everyone that the disability policy seminar is coming up, and to recommend that everybody register for it. It's a great opportunity. Maura and I and many others, I'm sure on this call, have gone. Typically it's in DC. Last year it obviously went virtual because of COVID, and it's virtual again this year. But we're planning another meeting with Senator Warren's office and Senator Markey, and along with the entire Massachusetts delegation. But, you know, leading up to our virtual Hill Day on the 22nd, you know, the seminar is just a great opportunity for self-advocates and family members, advocates and staff, direct support staff, and experts in the field. It's an incredible opportunity for everybody to get together and learn about, you know, what are the current issues that our community is facing. So I just highly recommend registering for it. And so then I'm going to hand it off to Maura for the state update.
Ellen, I would just add a big, huge shout out to the ARC of the United States. They typically run and have huge involvement in that day, but also everything we just spoke about with Susannah has been on their mission and their priorities for years. So to see some of this come to fruition, we know what an impact the ARC of the US policy team has had. And all of our ARCs around the country that have, you know, taken part in the advocacy as well. So you guys as well, but really huge shout out to them. So I know we're already kind of over, so I just wanted to quickly go over what's happening just, you know, today in the legislature. And I don't know what happened to my slides, but the little headings got so tiny you can't see them at all. But the first heading is just the budget, right? So right now meetings and debates are occurring both in the House and in the Senate. Some of that's happening simultaneously this year because I think of the crunch and COVID and the challenges for all of these folks to meet virtually or in a hybrid way. But it gives us an opportunity to just continuously reach out around our budget ask. And I know we had put out an alert probably, you know, almost a month ago, and then put it out again for folks to send to their reps and senators. We have a slight problem right now with our alert system. So we had to take the actual action alert down. We're working on it. It was kind of mixing up legislators, and it's not our system, it's the Mass legislature's system. So trying to work around that. But in the meantime, if you can, all of you guys, reach out individually to your rep and senator with an email. They already have our ask. You can just reference the ARC's budget ask and that you really support it. I think all of you guys know it's $15 million in day programming desperately needed, and $7 million in both family support and transportation, and then maintenance of all other lines in our budget. So Leo and I have been meeting with leadership, and we have another meeting today at 1 that we will be also bringing in this, you know, 1-year funding and the federal matching and how that can really help boost our budget. And you know, and then following up from there around the bigger changes coming. But yeah, so if you can reach out on the budget, we had a really great outpouring of letters around the vaccine prioritization, which I totally understand. We really needed to push, and I'll tell you more about what happened about that, but we didn't get a whole ton of budget letters. So if you can do those emails, that would be great. The other thing that's going on simultaneously is our co-sponsorship asks for our bill platform. We have a pretty big bill platform this year. I've gone over it in other meetings, about 18 bills. And we're asking the entire legislature to consider signing on to our entire platform, yet we're also going back and talking directly to our friends, our champions in the legislature, and asking them to really prioritize these bills. So if you can reach out to your rep and senator, if there's a particular bill that's really important to you, go right ahead and push them to sign on to that, and to do more than sign on, to really take it on as one of their priorities, and work with their colleagues to sign on to it as well. If not, you can just ask them to sign on to the entire platform for the ARC. And then, if you can start thinking about these bills that are important to you, what's your personal story that you can attach to that bill? Because that will be really important as we move towards committee hearings, and we'll be asking for those stories or for you to, actually take the time to testify. This year it will all be virtual, might make it a little bit easier for folks. So that's the bills. And then some news around the vaccine. We did a great job. There was way over 2,000 letters sent to the legislature asking for either full prioritization of people with IDD and autism and their caregivers. But then recently we kind of pivoted to say, all right, we're really pushing it. Maybe what we could do, since time is moving and the eligibility is opening up, is that we could request to have IDD and autism added to the medical conditions list, the comorbidity list for Massachusetts, so that at least our folks could get in April 5th. I believe that's when that opens up. And in doing that and in sending that letter out, we really caught the legislature. And Rep. Christine Barber took our letter, and she wrote a letter to the governor and then sent it around to her colleagues, and Senator Lovely on the Senate side did the same thing. So yesterday afternoon, they sent a letter to the governor with over 80 signatures. Really good effort on their part because of the letters they received from all of you. So, so fingers crossed. It would be great if we could bump it up. The other thing that came out this week was the, I'll admit this person, was the mobile home vaccination. And although, it's, I think there's some confusion around that in where some people believe that individuals with IDD and autism are homebound. And yes, some are, and some really will struggle with trying to get to a vaccine site. So perfect for them to go through this home mobile vaccination. But it's also important to realize that most of our community is not homebound, and that we are able to go out and work and be in the community. So this, as much as it was wonderful for the more complex folks, we still need to get that message across that, our community is out there and we need to be protected. So I think that's all for that update, if anybody has any quick questions. Zip through that pretty fast. Well, it's great to see everybody. Thank you. So Susannah, if you're still here, thank you so much. I don't see her. Hey, Paul.
Susannah had to.
Okay. All right. Well, be in touch if you have any questions, folks. We'll see you next month.